ഭാരത് ടിവിയുടെ മാന്യപ്രേക്ഷകർക്ക് സുസ്വാഗതം. ഇന്ന് നമ്മളോടൊപ്പം അതിഥിയായി ഇവിടെ എത്തിയിരിക്കുന്നത് ഡോക്ടർ രേണുക അൻവേക്കറാണ്. ബാംഗ്ലൂരിൽ അംഗം ആയുർവേദിക് ട്രീറ്റ്മെൻറ്റ് സെൻറ്ററിൻ്റെ ഡയറക്ടറായ ഡോക്ടർ രേണുകയെ നമുക്ക് ഭാരത് ടി വിയിലേക്ക് സ്വാഗതം ചെയ്യാം. ഡോക്ടർ രേണുക, വെൽക്കം ടു ഭാരത് ടി വി.
താങ്ക് യു ശുഭ.
പല ജനങ്ങൾക്കും പല ആൾക്കാർക്കും ആയുർവേദം എന്ന് പറയുമ്പോൾ ഒരു ഭയങ്കര സംശയമുണ്ട്, എന്താണ്, തെറ്റിദ്ധാരണയാണ്. Can you explain it? What is Ayurveda?
Ayurveda is a science of medicine which is very native and indigenous and very ancient in India. The actual meaning of the word Ayurveda means the science of life. Here, when we say the science of life, it not only advises us about how to live life, but also the means and methods of achieving a good life in this lifetime. So, when we talk about Ayurveda, the scope of Ayurveda is very, very large, and I wonder whether in this short time frame I'll be able to explain to you the exact, the whole scope of Ayurveda. So, maybe Shubha, you can ask me some questions which can direct me to actually speak to the viewers if they have any questions, or what you think is relevant to the show today.
സാധാരണയായി ഒരു ആയുർവേദ ഡോക്ടറെ കാണുമ്പോൾ അവരപ്പോൾ പറയുന്നത് വാദം, പിത്തം, കഫം, ഇതിലൊക്കെ നിങ്ങളുടെ ശല്യം എങ്ങനെയാണ്, എന്തൊക്കെയാണ്? ക്യാൻ യു എക്സ്പ്ലെയിൻ ഇറ്റ്? എന്താണ് അതൊന്ന് പറയാൻ പറ്റുമോ?
Yeah. According to our science, if I have to explain Vata, Pitta and Kapha, I'll have to go back to the basic principles which govern our science. The basic principles go as: the body is made up of the 5 elements of nature: water element, air element, fire element, the ether element, and the sound element. So these are the 5 elements that are present within the human body and also in the external environment. This is the microcosm and the macrocosm. So when you find that there is similarity between microcosm and the macrocosm, we have to bring down the bodily functions and what governs the bodily functions down to some kind of qualities which we can attribute to the body. And Vata, Pitta and Kapha are combinations of the Panchamahabhutas, so that they are doing some certain actions in the body. So that is Vata, Pitta and Kapha. Vata is a combination of the air and the Akash element. The Pitta is the fire and the water element. And the Kapha is the earth and the water element. These are the elements that come. Though they are very abstract in its nature, we can see the action in the body and find out what the Vata, Pitta and Kapha does in the body. When the 3 elements are in the normal state or in a pacified proper state, all the actions and the functions in the body are taking place at its optimum level. Now, Vata, when I say, it is not just the air that is passed out in the body or the breath. It comes under the gamut of all the nervous impulses in the body and all the sensations and the movements that take place in the body. The Pitta happens to be the total metabolism that contains in the body, that happens in the body rather, and it is you could see that in your digestive system, the expression of the digestive system. The Kapha element in the body is responsible for keeping your body in a compact and straight state.
ഡോക്ടർ ഇപ്പോൾ 5 എലിമെന്റ്സിന്റെ കാര്യം വിശദീകരിച്ചു. അങ്ങനെയാണെങ്കിൽ എന്തുകൊണ്ടാണ് ശരീരത്തിൽ രോഗം വരുന്നത്? അതിനെക്കുറിച്ച് ഒന്ന് വിശദീകരിക്കാം.
Yeah, as I was explaining earlier, since the microcosm and the macrocosm have got common elements, the only mode of interaction between the external environment is through our food, the activities that we involve in the environment, and the other habits and other things that we have. So we call it ahara, vihara and charya. The food has got the same qualities that can increase vata, pitta, kapha, or reduce the vata, pitta, kapha and derange them a little bit. These interactions together will be the cause for disease. Now when I come to vihara, it means our lifestyle, the way we interact with the environment and the way we go against certain natural urges that we have in the body. We are not supposed to curb our natural urges, and when we do that, we give rise to diseases in the body. So these are the 3 main reasons for which diseases are caused in the human body.
Nowadays people are talking about lifestyle disorder. What is lifestyle disorder? Can you explain it?
See, lifestyle disorder is a self-explanatory word. So when you say lifestyle disorder, there is a certain lifestyle which a human being has to follow, there are certain tenets he has to follow to maintain a healthy lifestyle and to be healthy. When he goes against it, lifestyle disorders occur. To give you an example of lifestyle disorder, it is this pre-diabetes or diabetes condition, heart diseases, and even cancer to some extent becomes a lifestyle disorder.
ഇപ്പോഴത്തെ ഈ ജീവിത സാഹചര്യത്തിൽ എല്ലാവരുടെയും തിരക്ക് പിടിച്ച ജീവിത ശൈലിയിൽ ആയുർവേദ ട്രീറ്റ്മെൻറ്റ് വളരെയധികം സമയമെടുക്കുന്നു. പക്ഷെ എല്ലാവർക്കും ഇൻസ്റ്റൻ്റ് ആയിട്ട് പെട്ടെന്ന് അസുഖം മാറണം. സോ എന്തുകൊണ്ടാണ് ആയുർവേദം വളരെ സമയം എടുക്കുന്നത്? അതിനെക്കുറിച്ച് ഒന്ന് വിശദീകരിക്കാം.
I think that question is there is a misconception there that Ayurveda is very slow in its action. Actually, we have got many medications which act instantaneously, but the people who approach us always come to Ayurveda as not as a choice, but they come as a chance. When they have already visited the Western components of the of medicine, that is allopathy, we find a lot of time that we are unable to directly tackle the cause of the disease. Since Ayurveda goes to the root of the problem, the medications that they have already consumed in the allopathic medical system has spoiled a lot of things for us in the whole picture of the disease. So we will need to detox the body of the medication that has been taken, because allopathic system of medicine approaches in a different way and we approach the treatment and the patient in a different way. Allopathic medicine tackles the disease and we treat the person as a whole. The difference is there. So once we start detoxing the body, it will take some time for the body to start accepting our medication, and hence it is perceived as a slow medical system, but that is not the fact. If you approach an Ayurvedic doctor in the initial stages of the disorder, we will definitely be able to give you faster relief.
ആയുർവേദത്തെക്കുറിച്ചുള്ള തെറ്റിദ്ധാരണ ഇപ്പോൾ ഇവിടെ തീർന്നിട്ടുണ്ടാകുമെന്ന് വിചാരിക്കുന്നു. അങ്ങനെയാണെങ്കിൽ ഡോക്ടർ, പഞ്ചകർമ്മ എന്ന് പറഞ്ഞാൽ എന്താണ്? അതുപോലെ തന്നെ ആയുർവേദവും പഞ്ചകർമ്മയും രണ്ടാണോ? അതിനെക്കുറിച്ച് ഒന്ന് വിശദീകരിക്കാമോ?
Yeah. Ayurveda and Panchakarma are not different. Panchakarma is a very, very important part of the treatment in Ayurveda. When we say the treatment in Ayurveda, we have got two types. One is an external treatment and one is an internal treatment. And part of the internal treatment would be the Panchakarma. It is supposed to be the speciality and one of the best modalities of treatment in Ayurveda. When we want to remove the diseases from the root from the body, we resort to the treatment called Panchakarma. Panchakarma, as the name itself suggests, it is a group of 5 treatment modalities. Vamana, where we get the person to vomit out all the toxins in the body. Virechana, where we get the body to pass out the toxins through the colon. And we have got 2 more called Basti, which are medicated colonics. And the last one is bloodletting. And one more, which is called Nasya, which tackles the ear, nose and throat disorders or the diseases above the clavicle. These are the 5 treatment modalities, and with these 5 treatment modalities, every part of the body can be cleansed. And diseases once treated by Panchakarma are either in remission for a very long time or they do not occur again.